According to a new study by Healthcare Quality Payment Reform, more than 100 rural hospitals have closed their doors during the past 10 years. Now, this means millions of Americans don't live or don't have access to health care in their rural communities. So our reporter Ivana Olivas has been investigating the issue and has more on how this national problem translates on more of a local level.
Out of the 43 rural hospitals in Colorado, 18 of them are at a loss on services, meaning that their profits are less than their costs. So how long will these hospitals survive while they're in the red? Hospitals in rural areas are few and far between. Along the western slope, Delta Health Hospital is one of them. It provides medical services to thousands every year and is the second largest employer in Delta County, providing jobs for more than 600 people.
But what is most important is that given the fact that we're a rural county, there are individuals that are driving 45 minutes to an hour just to get down here to the hospital. So imagine if Delta Health wasn't here in Delta, where would those patients go? They would have to go.
A rural hospital like Delta Health is not the same as a large central medical facility. Funding is limited and community needs are different.
You know, the state and federal government are constantly kind of considering that all healthcare systems are apples to apples, and they're not.
Financial experts say general inflation is to blame, with medical supplies and labor costs going up. But Medicare, Medicaid, and private insurers aren't meeting that increase.
So we had costs going up, 10% a year, and payments going up 3 to 5% a year. And that quickly really begins to deteriorate these hospitals' financial condition.
Financial problems can lead to the closure of essential hospitals, and without accessible medical care in isolated rural areas, residents must drive far distances. In emergency situations, a few miles could be the difference between life and death. In 2022, Delta voters approved a tax increase that helps the hospital's finances. Placewise tells us Delta Health is in good financial standing as of now and will not close its doors anytime soon. In Grand Junction, I'm Ivana Olivas reporting.
And a little reminder for the second part of this series, Rural Hospitals in the Red, it will air tomorrow night right here on the 10.